Hey, hi everyone. Welcome to the University of Toronto Joint Centre for Bioethics seminar series. My name is Jay Shaw. I'm Research Director of AI Ethics and Health at the JCB, and I'll be the moderator for today's session. And our speaker is Heather Dekker, and her seminar, the seminar is titled The Ethics of Artificial Intelligence for Public Health in Canada. And before I introduce Heather, I'd like to let you know that the seminar is being recorded. The lecture, along with other archived lectures, can be accessed through the Joint Centre for Bioethics YouTube page. And the format is that we have the presentation by our speaker, followed by a facilitated discussion period. And I'll begin with a land acknowledgement. So for thousands of years, it's the land we're on here at the University of Toronto has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, it's the meeting place and the home to many Indigenous people from across Turtle Island, and we're grateful to have the opportunity to live and to work on this land. And now it's my great pleasure to introduce Heather. Heather Dekker graduated from the University of Western Ontario with an honors specialization in medical cell biology and a major in genetics. She went on to study drug resistance in colon cancer as a master's student at University of Waterloo School of Pharmacy. And from there, Heather pursued her interest in ethics and research by completing the MHSc Bioethics program at University of Toronto. Heather's practicum work and Capstone project involved exploring the ethics and mapping potential harms of AI in public health and healthcare in Canada. She approached these topics from multiple angles, including policy perspectives and the startup and small company landscape. Heather is currently a research ethics advisor at the University of Waterloo, where she is the delegated reviewer for the Faculty of Engineering. And in 2022, she was awarded the Martin McKneally Capstone Project Award for her outstanding academic accomplishments. So Heather, great to have you here. And on behalf of the JCB, welcome to today's seminar. So Heather, over to you.
Yeah, thank you for that introduction, Jay. It's good to be here. Some of you tuning in may be aware of this, but for everyone else, Jay was actually one of my supervisors along with Angela Power from Newfoundland. I'm also grateful for the opportunity to share my capstone work with everyone today. As you've likely figured out from the title, today we'll be discussing ethics, artificial intelligence, and public health here in Canada, but I will also be commenting on some of my experiences working through this project. While I know we have heard a land acknowledgement already, I also want to begin with an acknowledgement myself, because I actually completed my MHSc degree remotely, and I live, work, and am raising my family in the Kitchener-Waterloo region. So this is the traditional territory of the Anishinaabe, the Haudenosaunee, and the Attawandaron, also known as the Neutral Peoples. On this slide, you can actually see some of the land that I'm speaking of. These are photos I've taken over the years of living here. So some of them are from Huron Natural Area or by the Grand River. In one of them, there's even a snapping turtle that you can see. It looks really small in the picture, but it was quite large. I also want to acknowledge that the work that I have done and continue to do may impact many territories and diverse peoples, including First Nations, Métis, and Inuit. I really deeply believe that I have a responsibility to serve as a steward for the land and to honor the original caretakers of it as well. And I recognize that an important part of this is to continue to learn and acknowledge the history of this land, the impacts of colonization on the peoples, and to take active steps to repair the damages that have been done. Today, during this presentation, I'm going to give you an outline of the background and context of the project before diving into the different components of it. So these components include a briefing note, participating in a best brains exchange, and a consultation with the Public Health Ethics Consultative Group. I'll then round it all off with some future directions and next steps. But before I go any further, I'd really like to emphasize the approach that I took in this work. First, that AI is a tool, and this tool can be used to address questions, tasks, challenges, and goals within public health. Second, that this work focused on a narrow AI and not something like artificial general intelligence and speculation about and addressing other future ethical questions and discussions, of which there are many, But simply put, for our purposes today, we're looking at learning algorithms designed and trained to perform a particular task, often repetitive or based on patterns. These are techniques that enable enhanced predictions, which can inform decisions or automate processes. And I also did not delve into any particular domains of AI, such as machine learning, deep learning, and natural language processing, and so on. This is really taking an approach to the technologies that we interact with today and how we are responding to them here and now. In terms of how this project came to be, it is my capstone project from my master's in health sciences of bioethics at the U of T. So this project really evolved out of some of my interests in policy, ethics, and technologies. The focus on artificial intelligence in particular came just from a growing fascination on my part in it as a technology and the ethics that relate to it. I had recently started working with my supervisors for my practicum work, and they reached out to their various networks through which we ended up being connected with collaborators at the Public Health Agency of Canada. And after a few initial meetings to discuss the scope of the project, we determined some mutually beneficial parameters and expectations of this collaboration and set an initial output of a briefing note, which I'll describe shortly. An iterative approach overall was taken from there on that allowed for flexibility and responsiveness to different schedules, changing needs, and so on. The early stages of this really involved identifying gaps in the literature and what was needed. So this was all occurring in the early to mid summer of 2021, and I was essentially diving into a field that I had little experience in, but a keen interest to learn about. As I explored this topic, I noticed that there tended to be an individual rather than public health focus when discussing AI technologies and health ethics. And additionally, there seemed to be little in the way of guidance for public health decision-making involving these new and advancing technologies such as AI. All of this, along with my discussions with FAC, highlighted a need for further discussion about the ethics of AI in the public health context, particularly here in Canada, and suggestions and guidance on how to consider the unique aspects of developing and implementing AI. So in response to those gaps and needs, I composed a briefing note that was written with the purpose of supporting and encouraging those discussions. It really was a synthesis of the literature. So I took some existing FAC frameworks from 2017, which was the Ethical Deliberation and Decision-Making Framework in Public Health. There was an adapted version of that framework that came out in response to the COVID-19 pandemic. And at the time were recently released key principles in the ethics and governance of AI for health, and those came from the World Health Organization. So this briefing note provides really a straightforward introduction to the topic and impacts of AI in a public health setting, and draws out some of the ethical concerns that are unique to AI, some of which are common across new technologies more generally as well. The briefing note itself essentially consists of a straightforward primer on the topic and impacts of AI in a public health setting, highlighted key principles and ethical considerations in public health and AI ethics, and some suggested adaptations to the existing FAC frameworks to include that consideration of AI. This is really to help raise the awareness in and of decision makers so that they can better recognize limitations associated with AI implementation and can be equipped with the tools to ascertain what is salient to the AI decision within their given context. This slide is really a quick reference outlining those principles of AI and health as described by the WHO. And I'd like to note that there's a lot of similarity to the ethical considerations and dimensions that are outlined within the FAC frameworks. So some additions to note within the WHO here are the explainability component, intelligibility, and sustainability. Other than that, we see some pretty common considerations that come up, such as autonomy, safety and well-being, transparency, responsibility, and accountability, as well as inclusiveness and equity. The briefing note really starts with the one-page primer, though, on important issues that are raised by the use of AI in public health. So these are all present to varying degrees. First, we see that technological solutions might seem like an ideal and singular response to problems, but this can actually fail to adequately approach and address the complexity of issues faced and contribute to overestimations of the utility of AI tools. This can, in turn, divert resources away from other programs or interventions that could be more beneficial. In terms of technological literacy, this can be considered at several different levels. So we're thinking the public overall, public health workers, other end users. And this is important from the conceptualization to design part all the way through stakeholder engagement, decision-making, implementation, and monitoring. Low technological literacy can complicate the effort to implement AI-based technologies. And this could mean, people might misinterpret outputs, or is there adequate training and expertise available to even use the technologies or provide support and monitoring during their life cycle. There is also a myth of objectivity that can surround AI technologies, where people might assume that the outputs are objective. They might think, oh, hey, it's just like math, it's ubiquitous, it's everywhere. And this can lead to overlooking some ethical considerations or scrutiny of the technologies from different perspectives. One area that particularly stands out when discussing AI ethics in relation to public health is that there's a risk for group harms and the scaling up of harms and biases that can occur. So we must really take a close look at whether there is inequitable distribution of benefits and harms that are going to be associated with these technologies. Governance is another prominent concern because there are significant questions around accountability and responsibility that are raised by these technologies. So who is accountable to ensure that ethical considerations are addressed proactively? Who is responsible when something goes wrong? Ultimately, every decision to employ AI in public health is context specific and demands consideration of the political, social, economic, and cultural realities that will shape how the technology is used and understood. So as I've already mentioned, when putting together this work, I used the 2017 FACT framework for ethical deliberation and decision-making in public health, as well as the modified version that adapted it to the COVID-19 context. So this modified framework, the COVID-19 one, really demonstrated that relevant modifications regarding a topic could be done while maintaining consistency with the overall general framework that was presented in 2017. So this approach really guided some of the modifications and suggestions that I had for addressing AI for public health uses. And this slide here is a compilation of the core ethical dimensions and procedural considerations that are described in the existing FACT frameworks. And the asterisks indicate additions and expansions that were included in the framework with the COVID-19 modifications. So we see trust and justice, promotion of well-being, respecting persons, communities, and human rights. So that was one of the ones that was expanded a little. Minimizing harm, so considering the effectiveness, proportionality, reciprocity, and precaution, working together as well. In terms of procedural consideration, we see accountability, openness and transparency, inclusiveness, responsiveness, responsibility, and intersectionality. So if you recall back to the slide that had the principles from the WHO, there's a lot of overlap between these as well. Now, these four ethical considerations are suggested as expansions to the 2017 framework that would incorporate and integrate some of the concerns that we had around the use of AI in public health. So we see privacy, so thinking of information from and about people and groups and the handling of that information, such as different controls and protections and whatnot. We see sustainability, and that's sustainability within health systems and environmental sustainability as well. Can these technologies be integrated into our existing systems? Proportionality. So this involves not only considering the level of response and measures based on risks, but also in terms of the benefits gained. For example, what might these groups gain from the data that is being collected and used for this public health purpose? And intersectionality. So in the design, implementation, and engagement stages, these should all involve those who are potentially impacted by the technologies, and there should be an intersectional lens that involves multiple and at times overlapping perspectives as well. So the adaptation of the framework for use during COVID-19 pandemic did include both proportionality and intersectionality as well. And those were also viewed within the WHO principles that were identified, but I felt it really important to draw them out given their importance within the AI context. The considerations and principles of accountability, transparency, inclusiveness, responsibility, and responsiveness are all very important in terms of serving a strong procedural purpose in evaluating AI-related activities. And finally, I sought to highlight equity within the consideration of justice and expanded on beneficence to expressly describe public and community benefit. I've mentioned these frameworks a few times now, but how do you actually go about applying a framework like this? So these are broken down into about 5 broad steps and these steps all follow within the original 2017 as well as the COVID-19 modified framework. And for my capstone project, what I did was I provided suggestions on adaptations to these different steps that would include the consideration of those AI-related principles, the ethical considerations, and some example questions that could be asked to help probe these. The ethical considerations are broken again into those 2 categories: core ethical dimensions and procedural considerations. So the first step in this framework is really looking at identifying the issue and context that you are seeking. You want to find the information, the facts, the thoughts around this issue to help you understand the context and the framing of it. So you might think of areas such as, what is the actual public health question or concern we're hoping to address? What are the goals of public or community health within this area? What are the community's interests? Who are those stakeholders? And what are the power structures present? So now when we take the approach and the lens of how do we look at AI technologies within this, we might ask, how will the proposed AI address this issue? Is there appropriate, objective, and independent governance in place to provide oversight on the decision and to proceed with an AI implementation? Why is using AI a priority in this instance? How does this AI support the goals of public and community health? How does this AI advance the interests of the communities impacted by its implementation? Are there skilled and trained individuals able and available to implement and monitor the technology? Is the technology designed in an inclusive way that is understandable to a diverse public and a broad range of end users? Whose data are used? Who owns and controls the data? And where are those power structures present? Moving into step 2, we're now going to take some of that context that we've identified. We're going to really look at identifying the ethical considerations and discussing those values around everything. So for this section, I really focused on drawing out some of those questions that might help critically evaluate those values and where the impact of AI might be felt. This here is a table. I've modified it slightly, but it is essentially one of the tables that was included within the framework that, within the briefing note that I composed. And it's broken into those different dimensions as well as the AI considerations. So when looking at those core dimensions, some questions that we might want to be asking are, are the data that's used for development of the AI solution representative of the population? Has the data been evaluated for overall integrity? How will individuals or communities benefit from the implementation of an AI for public health solution? How have issues of justice, equity, and potential for discrimination been addressed? Does the proposed AI for Public Health initiative also address concerns of disadvantaged populations or communities that may be impacted? Have opportunities to build public trust throughout the development, so the design and build and the implementation of this AI for Public Health initiative been considered? Has meaningful engagement with impacted individuals, communities, and society as a whole been adopted? Are there disproportionate harms, benefits, burdens to particular communities relating to the development and implementation of the AI. So a lot of these touch on multiple of those core ethical dimensions. So we see mention of trust and elements of justice and beneficence. For those procedural values, is there a clear overarching governance model in place to ensure that oversight and accountability? To whom would inquiries or complaints be addressed if and when they arise? Is there meaningful transparency around the use of AI for public health purposes? How is meaningful transparency even applied such that individuals and communities are aware of how decisions are made and understood? Is there transparency on how data has been captured and used within the AI solution to produce analytics and other results? So discussion of transparency keeps showing up in many different spheres. This has shown up also throughout the public health conversations over the last several years, where transparency or lack thereof has impacted how the public has engaged with different messaging. So I think the phrase hindsight is 2020 in particular is fitting. Bad joke there, I'll admit. We can also perhaps really look at what the aspects of transparency might mean with that and take an expanded view. In terms of additional AI considerations, we're going to get into some questions around contracts and partnerships. Do agreements reflect the necessary provisions to address ethical and legal implications? Do they address matters relating to data ownership, intellectual property, and privacy? Have issues of potential bias and discrimination been identified and addressed? How does this application of AI contribute to public good? Are there competing or conflicting interests even between the public good and the private benefit? Are there skilled and trained individuals there to monitor? What are the demands this technology will put on our systems and infrastructure? Do we even have the necessary infrastructure in place to support it? And what are the costs of this technology, such as in energy consumption or environmental impacts? What is the overall system sustainability even beyond environmental? So these are a lot of really big and deep and significant questions, but they do warrant asking, and we really need to get at the core and the heart of what some of the values are of the different stakeholders involved in these conversations. For step 3, we're going to look at identifying and assessing the options that we have available. So here we would be looking at and reflecting on the potential courses of action. Again, we want to be highlighting the question of how does applying the AI technology actually address this issue? You may have noticed that there's actually been a lot of chatter and hype around some AI technologies hitting various headlines. And there's one question that I really haven't seen or heard asked nearly as much as I would perhaps like it to be, or maybe it should be, and that's, is this a necessary and relevant application of AI? So getting into some of those details, is it actually addressing a need? And then what is the likelihood that identified options will effectively address the public health issue? For step 4, we're going to select the best course of action. So out of all of the options that you have been weighing, what aligns best to those prioritized values and principles? And is the suggested use of the AI the optimal approach in this to deal with the gap in the need? And who's going to be implementing this decision, and how can it be implemented fairly? Now we're at step 5, and this step is very important because it really emphasizes the need for monitoring of technologies once decisions are made. So this is the evaluation step. So we're looking at questions around, like, were the objectives actually met and the framework followed when making this decision? Were the results of the decision consistent with those objectives? And were there any unintended consequences? Did its implementation create or exacerbate inequities or inequalities, and should the decision be revisited? All of that work on the briefing note occurred in a fairly condensed period of time during the summer months and early September, at the end of which our collaborators at FAC were able to actually share this document as part of the materials of a CIHR Best Brains exchange that was held in November of 2021. So the focus on this particular BBE was looking at artificial intelligence in public health, centering on partnership, equity, and interdisciplinarity. For those who may be unfamiliar with the Best Brains Exchange program, CIHR describes it as a knowledge mobilization program that really brings together senior policymakers, researchers, implementation experts, and key stakeholders to discuss high priority health-related topics identified by policymakers with an overall goal of supporting the integration of research and evidence into policy. I was very excited to have my work included in this. And I was also very nervous given the context. So this was quite an audience to debut this work at. There were representatives from the private sector, government, academia. Some people were international as well. And I was really immersed into these interactions and was able to, in real time, hear how some of the key stakeholders were thinking and acting in this space. One aspect I found particularly encouraging was that much of what was discussed at this Best Brains Exchange really affirmed the direction that I took for this capstone work in the briefing note, and really aligned with the thoughts that were not included in the briefing note as well, but were off to the side, kind of sitting on the side burner, not a back burner, the side burner. Now, at the Best Brains Exchange, there were several themes and guiding principles that kept coming up. These were all outlined in an executive summary that's available to the public online. And one of those was the realistic assessment of risks and costs is necessary. Now, there's definitely elements of risk and cost analysis built into the frameworks themselves to get at some of those details, but we can really pull out some of the more hidden costs, such as the climate impacts or perhaps humanitarian costs that might be associated with using these technologies. In terms of accountability, an emphasis was placed on accountability to people and populations rather than business or profits alone. So again, really highlighting the public aspect of public health here, while recognizing that there is a role and an important role for the private sector to be playing as well within this. In terms of building capacity, knowledge, and increasing comfort for AI in public health, this does relate somewhat to the technological literacy I was describing earlier. This is both at the public health level and at a community level. In terms of continuous learning, we're looking at how readily can these models and tools be modified and adapted as new information comes to light. So recall step 5 of the frameworks, where evaluation and monitoring are important. There was also great emphasis on the need for transparency. Transparency and trust go hand in hand, and public trust is crucial, not only in the context of public health, but also to the wider research community as a whole. Speaking of communities, co-creation with communities is a very key element of this. So we're bringing up the concept of meaningful engagement here and co-creating and developing of things. This is closely linked to discussion of data collection, use, and sovereignty as well. It's important to have personnel with expertise, such as a multidisciplinary team who can adapt to changing situations. So this might involve people from public health, those in the humanities or social sciences, team members with expertise in AI, community members as well, and looking at equity and inclusion. So taking that intersectional lens, considering the technologies from the different points of view and the existing systems in which the technology is situated. We're really looking for intentional use that adds value and focuses on the needs and priorities of public health and the population served. So is it necessary? Is it reasonable? Remembering that AI is a tool, it's not a toy for us. After the Best Brains Exchange, I reflected on what was discussed and really tweaked the briefing note based on some of those conversations. And I sought feedback from others, like my FAC collaborators and my supervisors on some of those minor adjustments. Going forward, my supervisors and I agreed that it would actually be helpful to seek further in-depth feedback regarding the content and direction the work was taking before expanding it. So this all led to the next step in my capstone work, which was a consultation with FACT's Public Health Ethics Consultative Group, so PHECG. The group itself exists as an external advisory body and provides advice to FAC on ethical issues and questions. It really is there to help support decision-making, service delivery, and various other activities. So we wanted to look and evaluate at how my work was tracking and existing with the thinking and applications that we're aware of, and how could it be improved? Were there any aspects that could be expanded on more in a report, for example? So kind of taking those next steps and where to develop it. In order to have a consultation and receive feedback, there are forms that need to be filled out. So a request for advice was submitted. And in this request, we provided context and background of what had been done. So that's looking at the briefing note and some of the contributions at the Best Brains Exchange, as well as what future steps we thought could be possible. And within this official request for advice, we actually had and outlined the different questions or areas of questions that kind of we were hoping to pose. So some of the topics of the questions that we were posed to them were about how do we actually approach and coordinate governance with diverse stakeholders. There's immense diversity in the stakeholders in this conversation, and they all have their own ways of doing things. So how do we really approach that? Suggestions on how to embed meaningful public engagement throughout the process. What are examples of appropriate oversight mechanisms? Have they seen any? Do they have any ideas around this? Should we make clear statements and commitments relating to things such as secondary use of data and data collection methods? In terms of other areas, how do we navigate an evolving global and Canadian privacy landscape? So one of the details of a question in that is, how do we approach this when we're trying to balance maximizing the benefits that we can get from the data while ensuring adequate protections are in place? So thinking of data ethics as well in a stewardship model, which could be, their own several presentations on those. So some of the questions specifically, another one was, and I think this was a really important aspect to our proposal and request for advice. We really wanted to know if there were any priority concerns that this group had in terms of regarding the use of AI in public health. So during this consultation, there was active dialogue as we engaged with these questions and asked and provided more context within the presentation itself. And a few weeks later, I did receive detailed written feedback. Now, one of the first suggestions that was there was that I should clearly define what is meant by AI and what we are meaning by AI in approaching this discussion. So if anyone from that consultative group is listening in right now, I did have all of you in mind when I put together the framing of AI slide at the start of this presentation. So there you go, already putting together some of that advice. Along with the framing of AI, though, we need to include clear definitions. So what is meant by equity? What is meant by certain aspects of accountability or privacy? When we're writing up this report, because there are different disciplines who are likely to engage with it, and they may have different understandings of the terminology. So we want to be on the same kind of level when we're having these discussions. It's really important as well to consider what the goals of further developing this work are, because that's going to really tailor the approach that's taken. So is the focus going to be on education, where I would perhaps try and inform public health practitioners and decision makers about this topic? Or is it more having a deliberative tool or aid that can help with the decision-making process and look through the intentional use of AI in public health settings? Or is it guidance, where we're providing substantive guidance on this as an ethical issue of AI in public health? Another element that really came out through this feedback was the importance of including case studies. Now, cases can really help in developing an understanding of how to weigh and balance the different ethical principles, considerations, and values. And this really gets to the heart of what it looks like. You know, how do we translate that theory into practice? A lot of the feedback and advice given to me, both immediately during the consultation and afterwards in the written document, was around elaborating on some of these key areas, and some of which I'll go into shortly as well. But one thing that I found particularly interesting and exciting was that I did receive a lot of encouragement in this. And they really actually were saying, you know, hey, you can probably dial up the heat on some of these conversations. You know, we need to be asking those hard questions. Encourage others to think about what implementing technologies in this area might mean for their own context even. So that was exciting to say, have them say, go for it, make it a little bit more intense. But moving on to some of those key points that they highlighted, I'm going to begin with data sovereignty. AI is a data-intensive technology. When we consider data sovereignty, we're going to be looking at supporting the rights of individuals, groups, or communities to control their data. So thinking of things such as ownership, collection, possession, protection, sharing, and really taking a look at the life cycle of the data as a whole. Data sovereignty is important to expand discussion on, both in the context of specific groups, but also for the general public. Once again, transparency was highlighted. It's fundamental to trust. I'm not going to explain too much more about this. I've spoken a fair bit already in this presentation on this, but as you can see, transparency has been showing up across the board here. And then this next point here, some people might think of as perhaps a bit of an elephant in the room. And that's really the interplay of the private sector when it comes to using AI technologies in public health. So the private sector will be central to the development and implementation of technologies. A lot of innovation comes from the private sector, and that's good. It's important to have innovation. But there are definitely going to be ongoing challenging conversations about the nature of private and public interactions and how and where governance occurs and where responsibilities lie. In public health, there are also overlapping domains that impact social and commercial determinants of health. So in light of the potential implementation of AI in other areas, there really needs to be some serious consideration about how these domains interconnect. Take, for example, the criminal justice system. What happens when AI starts getting applied in different contexts there? How does that relate to public health and vice versa? Or how does environmental monitoring impact decisions that public health might be making as well? Governing and decision-making around AI can likely actually be viewed as a wicked problem with no clear-cut solutions. There are many diverse use cases. It's situated within complex social, political, and economic contexts. But ultimately, the goals of public health must be central to any decisions being made. It is vital to ask whether and why AI is a necessary and appropriate tool for addressing a particular public health challenge or problem, and to recognize that appropriateness must not consider efficiency alone, but also considerations of equity, distribution of harms and benefits, and other areas of public health ethics as well. On to the next steps. So an important part of considering next steps actually involves looking back on what's been done before and identifying perhaps where some of the limitations were. So there are a few limitations and challenges that are associated with this work that I'd like to really pull out. First, this was developed while collaborating with quite a focus group. So it was largely developed with guidance and collaboration from FAC and a few people in FAC. And it was advantageous. This isn't just a limitation. I want to really emphasize that it was highly advantageous to have the involvement of these people, these policymakers. But given the nature of the conversation of AI in public health, it certainly would benefit to have to broaden this input into the conversation and to invite others to the table, so to speak, because their contributions are valuable and needed. Along with this, though, everyone brings to the table their own suite of values and considerations. Some of those align and some of them diverge. And approaching this discussion can be really quite delicate at times. There are highly complex interactions to navigate between private sector, government, academia, other key stakeholders. And I really saw some of this starting to come out actually in that Best Brains exchange. You hear, you can kind of start to identify where some of the values or people's interests are lying. And that's totally normal, human interactions. On the same note, though, given the diversity of the disciplines involved, there really do need to be those expansions and clear definitions used in whatever materials that come out, and in these discussions. If we keep having people come together for discussions, I think that's going to be a really excellent aspect to grow and develop a bit more. In terms of strengths, though, pretty much everyone I spoke with was in agreement that this is a very necessary and timely work. It's here, it's now. How are we responding to it? As such, there was a lot of interest from many different people. And while I didn't speak much to this during this presentation, we did start to seek to engage a few different people and different areas within this. And I also didn't say much about other people that we were thinking about, such as, and groups such as research ethics boards. So some of the questions that were actually kind of hovering off to the side for us were how would we enable and support REBs as one element of that conversation. They oversee research to help safeguard participants, human participants, and how can they be equipped to review research that involves technologies such as AI and data use on a scale that perhaps they may not have seen before? What questions do they have in this area? There's also plenty of opportunities for education, public engagement, and so on. There are some very clear expansions to this work, such as developing a report or a framework or explicit guidance on this. And when I received feedback from the consultation, I'll admit that it was actually quite close to the end of term, and I had a lot of other projects to wrap up in order to finish my degree and whatnot. So there was a lot going on, but I do think that there's a lot of opportunity to expand this. In addition to that, I mentioned on the previous slide that there are educational opportunities in terms of developing those materials to share or present to support people on the ground directly involved with this work. And I'm also going to take a cheeky moment to say that there's an educational opportunity for me since I'm looking into pursuing a PhD. So that's actively something that's on my mind. Other than that, though, maintaining the conversation and discussion itself is going to be important, along with recognizing that it's important to see that AI for public health approaches really do raise unique implications and ethical dimensions to explore, and those go beyond those that are addressed in individual health conversations. So there's still a lot of work to be done regarding this exploration and integration of the ethics of AI for public health generally, and it's of fundamental importance that the discussion and guidance for ethical decision-making and use is available and ongoing. To kind of draw this to a close a little bit more, this work really highlighted for me the importance of different relationships. So how we engage in and with our communities and spaces, how we're taking actions to maintain transparency and build trust really underpinned much of what was shared today. On that note, I would like to take a moment to thank everyone who's been involved in this process, whether it's through supporting me as my friends and family did, or through challenging and insightful discussions as my classmates did over the few years. I'd like to identify that my fact collaborators were Rita Finley and Simone Martineau, and that we had a lot of really excellent discussion about what's necessary, where we can go, what steps would be useful. And my supervisors, Jay Shaw and Angela Power, for their guidance and scintillating conversations over my time working with them. This capstone project really lays some groundwork for incorporating ethical considerations into policy and decision-making around the use of AI for public health in Canada. It's a discussion that's salient given the current tumultuous political, social, and economic climate. And this is simultaneously enabling and disrupting technology. And so we need to figure out what we're doing, why we're doing it, and how we can move forward together. Thank you. There's my references.
Okay, thank you so much, Heather, for that great talk, reflecting on your experience of engaging, frankly, these important moments of policy development for public health in Canada, and also conveying the substance of this framework that you developed, the feedback that you got, and what you understand as being kind of important directions to pursue. So to all of those in attendance, it's time now for questions for discussion. So if you do have a question, please put it into the YouTube chat, or if you're not logged into YouTube, or if you'd like to ask a question anonymously, you can send your question by email to the email address jcb.ea@utoronto.ca, and we'll paste that into the chat for those of you who are joining by YouTube. So we'll take questions. We'll monitor the questions. And Heather, I'll just pose. I have a couple that I'd love to just hear you reflect on. No surprise there, I suppose. One of them is, so I'm sort of digging into a couple of the details of things that you referred to. So one of the points is around a prominent concept, it seemed, that came up a few times throughout your experience, which is around this, this question of, is this AI application, or is AI necessary here? Does it actually solve a problem? And that points to the sort of the decision point around, in fact, maybe the most ethical thing to do with this AI is not to build it or not to procure it, or, basically sometimes AI ethics is to not do AI, right? And I wonder, in your experience of the Best Brains Exchange and the multidisciplinary people showing up there, and the kind of feedback you got, and then the ethics consultative group, how did you find people responded to that? Were people generally really accepting of that point, or did you find pushback on that? What's your reflection?
So that one was a bit of a mixed bag. I think in terms of how people responded. I think there were definitely some more knee-jerk responses initially, depending on where people kind of situated themselves and their work. But I think as the discussion really developed and expanded, I think that everyone started to kind of come more centrally again and say, okay, actually, we can see that there are potential areas where this could actually improve the public health, the way public health approaches this particular question. And so implementing AI might actually free up some resources for us in other areas. And then on the other side, some people would say, actually, okay, yeah, we can understand, it's really easy to think that we can just quickly put together something. I say quickly put together here, but put something together, and it's going to fix this without recognizing the highly complex nature within some of these public health issues really are situated. So I think some people wanted to essentially the Gordian knot imagery kind of comes up, and some people wanted to just say, hey, our AI is going to just totally cut this free and whatnot. And others were like, but we're just going to kind of pull it and get just tighter. So it was I'd say that what happened based on what I was seeing as people really critically engaged with the discussion, they said, okay, yeah, this is a highly context specific sort of thing. You can't really make calls just on hypothetical, AI is always going to be good, AI is always going to be bad sort of ways.
Yeah, thanks, Heather. Good, nice reflection. And I mean, it's one of the things that makes this area so challenging is just how sort of far apart some of the perspectives can be as relates to this point, right? So I think you've sort of described that nicely. It's sort of, I mean, maybe a bit related. In one of your slides, you referred to power, sort of, looking at like power and incentive, who holds power in these circumstances. And I mean, maybe in the case of public health, like companies that are potentially building AI technologies in public health, perhaps they are bigger technology companies who have a lot of sort of financial resources, and that breeds power. But also, like, federal policymakers have a lot of power. Like, after having gone through this process, do you have a sense of how that tends to fall out? Is maybe public health is a bit different than medicine, like applications of AI in medicine, where there's a bit of a like different collection of resources and a different distribution of power. Just, sort of an invitation to comment a bit further on how you see power falling out in the domain of developing AI for public health specifically.
Mm-hmm. That's a very deep and intense question to start addressing. It's very multi-layered. I would say that in terms of it, there's definitely, as you were kind of getting on with the private sector, there can be a lot more availability of particular resources to the private sector, and perhaps sometimes fewer checks and balances that we have as part of our government systems. So in that sense, depending on what is being developed, that could end up really giving a lot more power towards the private sector in this. But we cannot, I think, forget the power of the fact that these are really data-driven technologies. So that's where the data sovereignty, I think, is a very, very core element to the conversation of power. It's who is owning, controlling that data? How is it being collected? And so this is something as well that can work in some people's favors, and also potentially disadvantage them. So I think that's where it actually then links into the technological literacy, because I think very rightly so, there are a lot of communities who are extremely cautious about data and data use and whatnot. But I think that what I would love to see is more all around development of that, the educational aspect and raising the literacy, so that everyone can critically engage with that. Okay, when and where is it an appropriate place to use this data? How can we do this well while still protecting our groups, our communities, while still respecting people's decision-making and their autonomy as well, too, in different aspects. So.
Yeah, okay. I think great link to that conversation. And you've maybe answered all of, or at least part of, a question from the audience from Jessica Dowden, who raised the question around exactly what you were just saying, like literacy on the topic. And it's literacy about data, but it's also literacy about AI as a technology, like what it does. But transparency, it has come up as this like really important topic. And how much does transparency matter if people don't understand it? Or how might public health officials approach the topic of transparency, given the issues around literacy? And just any comments you have on that, Heather?
Another doozy of a question. Yeah, it really. I think one of the first steps in that and how to approach that is taking kind of the pulse of the situation right now as a first step, is really recognizing we've seen a lot of headlines around AI. It's not necessarily around public health stuff, but there's a lot of headlines. What are people's responses when they hear about AI technologies in the news? Are they responding with fear, uncertainty? Are they excited? Where are those aspects kind of falling out? And I think that's going to the way that perhaps transparency, especially from governments, can really come into place is perhaps combating some disinformation and misinformation that might be out there around these technologies. So really starting to get just the baseline of what's going on. People don't like to hear after the fact that their information has been used in ways that they were not necessarily okay with, or perhaps, they would have been okay with had they been consulted about it in the first place. There are numerous different examples kind of you can pull out. Probably just do a few quick Google searches around some of this where people like to know what's going on. That involves some of the privacy aspect as well, right? People are willing to sacrifice elements of their privacy as long as, like, where are we asking where that locus of control is? Who is kind of controlling that? Which then goes back to that power question that you asked earlier as well. So it definitely all interconnects.
Yeah, rightly so. I mean, these questions are a doozy, but you've handled them very well, Heather. So that's great. Okay, I think we probably have time for one final question, and here's one anonymous one from the audience, just submitted by email. So first, some congratulations on winning the Capstone Project Award. And the question here is a bit more general. So, stepping away from your project, reflecting on the fact that you've had to grapple with, a wicked problem, something where there's multiple stakeholders, the specific issues are not super clear, and there's probably not a lot of shared understanding. Like, do you have advice for training bioethics students, scholars, practitioners in a program like the MHSc that you've gone through, or other ways? So any thoughts about how you might train the kind of next generation of researchers, practitioners in bioethics based on your reflections?
I like this question. Relates to education. I really like I like the whole idea of teaching and whatnot aspect of things, and sharing knowledge as well. I think one of the first pieces of advice I would have in that is actually to do some self-reflection and take perhaps a more humble approach to the conversation, and recognize that yes, while people may have expertise in some areas, they also lack it in other areas. And so I think if we can emphasize to people that we're training that you can be taught these approaches, these critical kind of thinking skills, really, but those don't exist in a vacuum. We are people relating with other people. I guess, on this topic, some people will say, well, when are we doing those relating with machines and stuff? But right now, at this point, we're people having emotional responses to what's going on around us. So how do we take that and teach each other about and learn and be able to say, hey, I am willing to learn, and being open to that. So I think those developing the critical thinking skills, saying it's actually okay to really not know about things and to collaborate with others and lean on their expertise. It's okay to say, hey, it's okay to be frustrated as well. Frustrated in the silos that a lot of discussions have existed in, frustrated with perhaps your own situation, frustrated with the way that the world is. I think that can be really used productively if we take an approach of respect towards each other when we're engaging with that conversation. And yeah, having the respect aspect is definitely an important aspect, I think, in training too. We talk a lot about professionalism, we talk a lot about stuff, but there's a reason social and emotional learning is being implemented more in schools with children. And I think a lot of us as adults could benefit from social and emotional learning as well.
I love it. I love it. Yeah. Great response, Heather. Thank you. Yeah. So, we'll have to draw the seminar to a close now. So just a couple points to make before we thank Heather, our speaker. One is that the next seminar will take place in a couple weeks on March 15th, featuring Sophie Rohr. And to sign up to receive the weekly seminar reminders from the JCB, you can email jcb.info@utoronto.ca, and I believe that will be put into the chat as well. And then for any CSB students in attendance, Please make sure to keep track of your attendance. And just finally, Heather, on behalf of all of us at the JCB, thank you very much for your presentation. Thank you.